Hi, I'm Ben Munson, editor for Medical Design and Development, and today we're chatting with Tarun Sondhi, cybersecurity lead for health at Accenture. Tarun, thanks for joining us.
Glad to be here, Ben.
Great. The recent cyber attack on Stryker's system garnered a lot of attention. Are these types of attacks on medtech firms becoming more common? And if so, why?
Yes, they are becoming a lot more common. As a lot of these attacks that are aimed at the operational disruption and not just data theft. We've forever heard about attackers going after data and then using that data for other things. But medtech sits in this kind of intersection of high impact part of healthcare and supply chain, right? They're high risk, high susceptible to attacks, and also they have a high impact on healthcare organizations. And attackers know this, that as soon as they create this downtime, which creates a very outsized consequence on a healthcare provider, all of those kind of mixed in, they become a prime target for a lot of the attackers. We're also seeing attackers are targeting these control planes. If you look at the identity and device management tooling, because these become one of those control points that they can disable very quickly and go after whatever the intended action is at the end of the day. And if you kind of take a step back from it, the connectivity of all these devices is exploding. We know that medical devices are becoming far more connected today than they ever were. And all the supportive infrastructure really hasn't been invested in a very long time to secure them. So this kind of creates this unfortunate concoction of different problems that have come together. And now all of a sudden we're seeing a lot more attacks like these in the marketplace.
Mm-hmm. Can you talk a little bit more about what makes connected medical devices so vulnerable? And then how can healthcare providers address these issues to improve visibility?
Yeah, so look, connected devices for a very long time have always had vulnerabilities, right? So we know that the average shelf life of a connected device is anywhere between 7 to 10 years. These devices operate, they don't really have to change a lot. And as new technologies come on, you get more and more connectivity and more telemetry out of them. But what we know is that a lot of these devices have legacy operating systems and software running in it. And today's threats just cannot, they just can't compete, right? So these old operating systems, the software that's running in it, the constraints around patching, they don't give you enough telemetry and they're not designed to deal with the new attack patterns that we're seeing from adversaries. For providers, the first place really is to unlock visibility. Know where your devices are, where they're connected, what part of the network that they're on, and who manages them. Just understanding those 2 or 3 things will give you that baseline of what normal looks like. And from there, you can react to any deviation from the baseline that you see.
Mm-hmm. It seems like a fairly simple place to start. Are enough healthcare companies doing this?
We are seeing that today there's a lot more attention that's being brought to getting inventory, getting telemetry out of these devices so they can react to it. But that's more recent. I think a lot more, if you look back at 2022, since 2022, there's 140+% rise in attacks against healthcare. Healthcare is the number one. And let me just pause and let that sink. Healthcare is the number one highest attacked industry. It's not banking anymore. It's not governments anymore as the number one, but healthcare is the number one because they're an easier target. Long list of uninvested technology, not enough investment in security, and now all of a sudden it's getting the investment that it needs. So the point I'm trying to make here really is that today we're far more equipped, and I think the CIOs and CISOs are investing quite heavily in managing and monitoring all these surfaces of attack that exist in healthcare. And I think this will continue to rise because we'll continue to see different techniques used by adversaries to get into an organization.
Mm-hmm. It's scary what you're describing, and I'm wondering: is it fair to call this issue a public safety threat rather than just kind of an IT concern.
It is fair. I think it was HHS that frames this, and I may get it, wrong, but I believe it goes something like, in healthcare, cyber risks are patient risks, and the disruption could cost lives, or something along those lines. And so, as you think about this, is that healthcare cyber really turns as weaponized to be able to stop patients from getting care. When clinical workflows are disrupted, monitoring, communication, ordering, documentation, all the activities that our clinicians perform on a day-to-day basis, they have to switch to more manual procedures. They have to go back down to kind of this downtime procedure that they may have established, and that increases risk. It increases delays, increases errors. So that's why, I continue to believe, and what we hear from the market is that it has moved from an IT security to really a resilience and safety. And that's where we're seeing a lot more shift happen, really down at the clinician level.
Mm-hmm. Okay, well, thank you so much for your insights on this really important issue. Appreciate your time.
Pleasure to be here.